Hi, this is Dr. Vierhusen, and I am recording this session for week 2 of Community Wellness. I didn't like how the class recording came out. I think it's basically because stepping away from the computer allows the microphone to die out. You don't get to hear the conversation. So I'm just going to go ahead and record the PowerPoint for anybody who was not able to make face-to-face class. And then at the end of it, we'll talk about what your assignment is to make up for not being able to participate in the discussion this week. So let me just share my screen with you and we'll get into this. It won't take too long. There wasn't a lot that we covered this week as far as the PowerPoint presentation. Excuse me. I do have my PowerPoint up on my second screen, so if you see me with my face to the second screen, that's why I don't have it on my primary screen. But you should be able to see that PowerPoint presentation right now. We're going to be talking this week about public health nursing models and the social determinants of health. And as we get into this, I think you'll get a good grasp of what actually is going on in community health. Again, this first few weeks is just an overview, looking at what actually goes on in community health, what populations we're actually looking at, what we're trying to accomplish, what goals we have. It's a little bit different than acute care nursing, but again, we treat community health, we treat the community by treating individuals within that community, but the reason we treat the community is we're looking at something that is a common risk among the community, whether it's obesity or smoking or teenage pregnancy or STI infections, just something that is within a particular population we are trying to manage. And we do that by treating the individuals, but we also look at it in an aggregate. We'll talk about that a little bit. So the COVID update this week, I wanted to share with you, since we didn't have anybody that was doing COVID updates this week, I wanted to share with you what this might look like when you're doing it. You don't have to have a PowerPoint presentation slide, although you are welcome to send one to me if you want to. And I will include it in the PowerPoint presentation. But this week there were a couple of things that happened with COVID, and I chose to put on the screen this one that was Major League Baseball. I love baseball, I watch it a lot. And we've had a very shortened season, just like other sports, but COVID has really played havoc with the schedule, even when it's been out. And so just Sunday, the Oakland A's came out and announced they were going to go postpone some games. This was after this already happened to St. Louis Cardinals. Before that was the Miami team. Is that they have COVID. Someone has tested positive for COVID, and usually that means that several will test positive because they are considered a family unit when they are playing together, and so they need to then isolate themselves from playing any other games. A couple of other things that came out this week. There was a report out of Nevada that talked about they had some data that showed that someone had been infected for a second time, a confirmed infection for a second time with COVID, which of course is kind of a community health nightmare for those trying to contain the pandemic, the COVID-19 outbreak. Because if we are building antibodies, and I do know we build antibodies because my son, I shared with you, my son had COVID, confirmed case, and he has 3 times donated plasma, and those antibodies are in his plasma, and he's donated those to convalescing individuals successfully. But if you can get infected a second time, a positive infection a second time, that means that we may indeed be looking at some other ways that we need to contain this. There was also reports coming out on COVID this week that it is possible that it is mutating, which we see happen a lot of time with viruses and bacteria, that it is mutating to a different strain, and that strain is much more contagious. It is less serious, is what the reports are, and not so deadly to specific populations, but it is much more contagious. So indeed, we wonder if we can contain that. So that's kind of what's going on in COVID world. We'll talk a lot about COVID, Ebola, tuberculosis, influenza when we get to communicable diseases. But for right now, I just wanted to show you what you might be talking about when you're talking about what happened in COVID this week. How is it impacting us, actually? The next thing I wanted to show you is that if you were looking for a role, a community health role, if you were doing a weekly report on that, and again, everybody will be doing one weekly report during the semester, either on COVID or a community health role, and I will have that list out next week. It doesn't start until the week after Labor Day. This one was from the city of Milwaukee. I just did a simple Google search for public health nursing, and this one came up. And what I really liked about this one to show it to you in class is the availability of the different type of settings that this community health nurse would be involved with. So it talks about homes and schools and clinics and community settings, all the places that community health nurses practice their craft. And then also that it really wants to assure that healthcare is accessible and available to the residents. Accessibility is a big thing. We've talked about it already. We will continue to talk about it. How do we make sure that residents can get the healthcare they need in order to reduce their health risks? It lists a bunch of programs here, but I think it's much clearer if we go to the site. So let's go ahead and go to the site. So here it is, it's on the site, and here you can go read more. And it actually talks about these programs. So let's just look at tuberculosis prevention and care clinic. So prevention is a big goal of community health nursing, of public health nursing. And here it says perform TB screening, assessments, and provide treatment to patients using established medical protocols in consultation with the medical consultant or the practitioners, and conduct and evaluate TB case investigations. So that's a big one. Let's look at another one. Sexual and reproductive health programs. Perform STI and HIV screening, assessment, counseling. I used to do that at a free clinic. Treat patients seeking services using established medical protocols. Participate in the prevention of STI and HIV and other communicable diseases through one-on-one counseling. I've done that. Group education, yes. And community outreach, I've done all of those. And then collaborate with local, state, and federal partners to perform epidemiology investigation and follow up with suspected or confirmed STI and HIV cases. That happens at the county level. So if you worked at a clinic and someone would have an STI infection, if it fell within a particular group of STIs, such as chlamydia, gonorrhea, HIV for sure, then they would be reported to the state and the state would follow up on that. So that's what this is referring to. All right, we'll go back to our PowerPoint presentation. So that is actually what would happen if you were looking at a role. And there are many, many roles. So I think you're going to see a variety of roles that you can pick from if you're indeed assigned one of those. So today we're going to talk about public health nursing models. We've got the Wisconsin nursing model that we're going to look at. And if you've done the module already, you will have seen that. If you haven't done the module, you want to do that before Sunday. You have an assignment due for that, submitting that completion report. It takes about an hour, hour and a half to complete. It's just watching a webinar and taking a quiz. And then we have the Minnesota Public Health Nursing Intervention Wheel, which is very widely used. We'll talk about that just a little bit. And then our local public health departments also have their own goals, their own missions, the things that they're going to do. Okay, so Wisconsin Public Health Nursing, what's the goal of that? And you can read this yourself. I'm not going to read it to you, but it really articulates that they're looking in the community and saying, who are those within the community that are at risk of illness, injury, premature death, or disabilities, and how can we address those? And sometimes it's things that we need to do, obviously, within the community in order to assess it. So let's say that we've got an accessibility issue where we live in a semi-rural area. We have a health clinic in town, but we have a lot of people that work or live several miles away from that health clinic. And perhaps there is no public transportation. So if it is an area that's socially, economically poor, you might only have one car per family. It might not be reliable. And people might have to go to work. And so the person who is the wage earner or both go to work during the day. And then if they come home in the evening, if the clinic is not open in the evening, they can't get to that clinic. They may not have sick time. They aren't able to leave their job in order to do that. Or they may indeed only have one car and one person uses that during the day, and then they trade off childcare, and let's say the husband then goes to work in the evening, and that car is in use all day long, and there's no transportation to take anybody in the family, let alone the children that need to go in for services. So accessibility is huge, and I know that I've mentioned that before, but it really is a problem in our country. Those of us that have cars Those of us that can use public transportation to get around a large urban area, we kind of take that for granted. Those of us that work in healthcare and have accessibility to healthcare and healthcare insurance, we take that for granted. But there's a lot of people that can't do that. And so they are choosing sometimes not to go for their medical care, sometimes for accessibility, sometimes for monetary reasons. They can't really pay all the rest of their bills. They can't put gas in the car. They can't put food on the table if they indeed are paying for a medical bill. I think those of us with insurance are shocked sometimes when we realize what it's like not to have insurance, what the costs of things are. A very vulnerable population in our state are the elderly. They, if they have Medicare over 65 and they're eligible for Medicare, if they have Medicare but they haven't been able to purchase a supplement, they can run hundreds and hundreds of dollars in prescription medications every month. And you probably learned a little bit about that in Giro. So we look at all of those things and then how we can address them. That's what we're going to be talking about throughout the semester. This health model, I was hoping that I could actually find at some point just a JPEG of it that I could stick into the PowerPoint, but I couldn't. But here it is. It's in a PDF form, and you would have seen this. It's available on the site that I sent you to. And I think all models can be confusing at the beginning, right? They really can, when you first look at it, they're very busy looking. But if you walk through this one, it makes a lot of sense. Start from top to bottom. And you're looking at, what's our shared vision? We want healthy people, right? We want safe people, and we want to have healthy communities for people to grow up in. And then we look at those overarching goals: promote and protect health for all, eliminate health disparity, which means differences in how people can get available to health and how they can secure it, and then transform the public health system. So it talks about its health priorities and its infrastructure priorities. I want to talk for just a second about infrastructure. It is very easy when things are tough for people to want to have more resources thrown at it, whether that's more people, like a staffing issue, and you say, why don't we just have more nurses on the floor? Whether it is money that needs to purchase like equipment or buildings or facilities that they could partner with, or whether or not it's time. But the infrastructure, the resources that provide that infrastructure are not infinite. They are limited. They are always limited. We don't have infinite resources for anything. We can see that with our environment. We don't have unlimited water. We don't have unlimited clean air. We don't have unlimited areas in order to produce crops to feed people around the world. So when we're talking about building the infrastructure, that's really important. And sometimes there's priorities within the community. You can see, let's say they have 13 priorities within the community that they really think are important and they should address, but they only have resources to address a few of them. Then they've got to take that list and they have to par that down, and maybe they've pared it down to the top 3, and they're really going to pay attention to the top 3. The challenge with paying attention to the top 3 is that you're not then addressing all of the issues that can impact risk. And indeed, you may have some populations that are still not receiving care because there's limited resources. So it can be a very challenging situation to solve. It can be very hard for the people that are involved in those priorities that fell to the wayside. And it can be a challenge if in one year, these 3 are what we're looking at. Let's say we're working on clean water in our area, and we're looking at public transportation, and we are looking at vaccinations. Those are the 3. But then something changes, whether it's the political environment, whether it's those of the people who are actually making those decisions, whether it's an outbreak like we've had with COVID. Then those priorities change. And let's say the next year the community says, you know what, COVID is our #1 priority. And so what of the 3 now do we have to have fall by the wayside? And that can be, those are very difficult discussions to have and very difficult to communicate with the public when funds are going away, when things cannot no longer be supported, when a facility is boarded up because there is not enough money to support it, and now what does that community do? And we see that sometimes, like I've talked about too, with food oases. We may be in a neighborhood where the grocery store has left And all that is left for the population who does not have transportation, let's say they don't, who don't have transportation, the only thing that's left is fast food. So they're eating fast food all the time, or convenient food, which if you go into a convenience store and you're buying foods there, now you're paying, you know, what, 150% of what you should be able to be paying for that at the grocery store. So that's really concerning too. So anyway, it talks about Wisconsin statutes then, which is very important. We always have to abide by the law, and those change all the time depending on what's going on politically. It's all connected. And then on the left-hand side, you see the things that are really integral to this model, where they got that information, where they pulled that information, such as the American Nurses Association Public Health Nursing Scope and Standards. That really feeds it. But on the right, in that blue area, you see what looks like the nursing process, and it's very, very similar. So we assess the community. We look at what things are really at risk in the community, what things are we diagnosed. Do we have a huge population of smokers? Do we have a huge population of people with heart disease? And then which ones are the priority for our budget, for our resources? And then we want to know, what are our outcomes? What are we going to be happy with? What are we going to measure? And how are we going to know whether we're successful? Then we plan, implement, and evaluate. And usually that's kind of a cycle then, right? You plan, you implement, you evaluate. Oh, we didn't meet our metrics like we wanted to. What could we do better? And then you re-plan, re-implement, and hopefully that evaluation is going to show that we're getting closer to what we need to get to. All right. And then we have our public health outcomes. So for Wisconsin, it's improved health and safety of the public and improve public health system capacity to assure condition in which people can be healthy and safe. And we learned all about capacity at the beginning of the pandemic, when we don't have enough beds for people. Okay, so that's that model. And you go into that a lot more in depth in the online module that I asked you to do this week in place of having to come to another class. And then this is a Minnesota public health intervention wheel. And you have a handout in Blackboard that I want you to review. It's only 3 pages. You can read through it. And what you will see is on this intervention wheel that we can do these interventions system-wide, we can do them community-wide, or we can do them for individuals. And it will talk about what these different colors mean and how we would assess a particular thing. So like, I'll go through and we'll just say obesity. If we were looking at obesity within our community health setting, then we would be looking for all of these different pie pieces to be covered. We might not have an intervention for everyone, but we want to make sure that each one of them is addressed. So we may say, how can we address obesity in our community by contacting community organizations, or building a coalition, a grassroots effort in order to address this in our neighborhoods, or collaborating with our local healthcare providers. Are those going to be some interventions that we want to do? Or we may want to say, how are we surveilling this? How are we actually screening for it? How are we tracking it? How are we assessing whether people are following guidelines and have better outcomes, better blood pressures overall? They're trending that way. How are we going to reach out to the public and get them educated on this? What is the best way to do that now? That's changed in a year. Could be we would want before, let's put out some community classes, free community classes for people with hypertension. They can come in, they can ask any kind of questions they want. They learn about hypertension, they learn about lifestyle, perhaps they learn about a better diet, the DASH diet for hypertension. Maybe they have an entire session on that. They may learn about the Mediterranean diet. Maybe they learn about those that are reactionary to salt or sodium and those who aren't. What is the newest research on that? And how can someone get healthy who lives with hypertension every day? What about the medications? Which ones are better than other ones? What do you find out about them? What kind of questions should you ask your doctor about your hypertension? How does obesity play into hypertension? So we can look at all of those things, and that's where that ties back in. And we can offer screenings. You can see that also on that kind of red to orange piece of the puzzle, the 1/5 of the circle, you can look at screenings. So we're conducting healthcare screenings today, and we will have people come in, we'll check their blood pressure, we'll give them some ideas on how they should do it. Maybe they can come back once a week and we can monitor that for them. Now that again has changed. We no longer have big group sessions in order to reach out to the public and conduct education for them. Now we have things virtually. Some people are comfortable with that, some people aren't. You know yourself, whether it's you or whether it's a loved one. You have some people say, I just would rather do that in person. I really don't want to do that online. And so we might miss a part of the population because we're trying to be safe with COVID. So please look at that handout. I would like you to just really get a good grasp of what the interventions are that public health nurses do. And then we have local. So I picked Washington, Ozaukee County Public Health. Ozaukee County is where our campus is. Washington is just west of us, Washington County, and they combined. They didn't feel they were big enough in order to have a robust public health department on their own, so they combined. It's actually in Port Washington, or Port as we call it around here. And the mission of it is to improve the quality of life by promoting, protecting, and enhancing the health and well-being of the public. Very similar to the other things that you've read. And then they want to foster healthy people, places, and communities. So if we go to this site, we can actually see that. We see that mission and vision on top. And this is really where the local public gets their information on COVID right now, the local public health. So while you as a student, if you have any symptoms of COVID, you're going to be contacted by the health services here on campus. I, as a professor, we don't do that. I go to my local health provider, and usually my own health provider is going to send me right over to the health department to get screened, to get that testing, and to get a guidance on what I should do. So it has information here, you know, should you get tested? What do you do if you get tested? What are our risk factors here? What is the data that we see here in Washington, Ozaukee County? We had quite a few deaths at the beginning of the outbreak, and you may not know what that's from, but really that was because we had some outbreaks in senior centers. And so the majority of these are from a couple of senior centers. We have one in Grafton, and I think one was in Port Washington or Sheboygan. And so unfortunately that was the case, but you can see that we're trending down. This is for 2 weeks. We're trending down. It groups it by age. So it's really good data information. If you were doing a report on what's going on locally for the health risks of the community, this would be a great resource for you. You could pull up all sorts of information here, and it talks all about the data that it has. And then down here you see it's got things for the different areas of public health. Emergency preparedness, we're going to talk about that later. Immunizations, vaccinations, communicable diseases we'll talk about. Maternal child health you'll talk about in another class, but certainly that's one of the biggest areas in community health, is how to affect mothers and children. And then community health and prevention and environmental health is huge. And it's got some updates at the bottom. So your local health department has a lot of information that is very, very important, not only to you as a nurse operating within that area, but to the families who live in that area. And they really try to connect with those families and be able to provide services for them. Okay, we're going to talk just a moment about social determinants of health. So social determinants of health, there are different ones, different categories. And so I gave you 6 of them last week, and it was, those were determinants of health that were widely accepted, but recently, widely accepted up until like a couple of years ago, but recently they've broken it down even more. And I think that the concept obviously remains the same. These are the things that are deterring people from having a healthy life. The social deterrents for having a healthy life. And how we say that is that they're avoidable. We can do something about these, right? You can't do anything perhaps about your genetic makeup, right? Maybe you can manage it a little bit, knowing if you have a predisposition to something, but you don't have a lot of control over those. But avoidable things within our environment, pollution, air pollution, water pollution, avoidable things within our infrastructure, how we build roads, where we put the schools, where we put shopping in relation to residents. Also about education. How can we get more people educated? Statistics will tell you someone who's more educated is going to take better care of themselves in general, not always, but in general. Food, again, how can we avoid those food oases? How can we have healthy choices for individuals in the school, at home? How can we educate people on how to eat properly? Community within systems, and how, in other words, how can we decrease discrimination? That's a huge thing right now, right? That we're facing as the nation is discrimination and protests for that. And then I think some criminal elements that take advantage of those protests and then come in and vandalize. So we've got that criminal element too. So if you live in a neighborhood, high crime neighborhood, you're going to have a lower length of life prediction. You're going to have a higher risk for infections and diseases if you live in a high crime area. And we'll talk about these things as the semester goes on. And then our healthcare system, do they have health coverage? Like I talked about, can they get to the doctor's office? Those kinds of things. What kind of quality do they have? Have they got doctor's offices that understand them culturally and in their language? Are we welcoming to the LGBTQ population, and can trans individuals get good health care? Many people will tell you no, that most places in the United States, they can't get good health care. So this is just a different category. The premise of what determinants of health have not changed, but you will see different categories identified, and I wanted to show that to you. So last week we saw 6, talked about behavioral, psychosocial, environmental, and so these are just reworded. Okay, so addressing these are really going to reduce health risks and increase lifespan is what the goal is. Healthy life, a healthy life, that's what we're looking for. The last thing we're going to talk about this week is health equality. Health equality and health equity are 2 different concepts. You see that on the cartoon here, right? In the first one, they're all trying to watch a baseball game. What appears to be the adult is tall enough by himself to be able to see over the fence, which is their obstacle, what's limiting their vision. We will not talk about right now about whether they paid for a ticket or anything like that. That's not what this is about. This is really about can they see that activity and what barriers do they have? And we look at the second person who looks like it's an older child, and that child really needs some type of boost. And then we see on the far right-hand side a younger child, and that child actually needs a larger boost in order to have the same view that all of them had. Well, if we talk about equality and we give everyone the same thing, then we still do not have equity in what they're able to view. So the adult gets taller, the middle child is now able to see great, the younger child on one box is still not able to see. And then if you look at equity, you're saying, well, that adult really doesn't need that help. The younger child really needs help of 2 boxes. And that's basically, in a very simplistic term, what equity is versus equality. But we're looking at really what is the absence of avoidable, unfair, redeemable differences among groups of people. And so I think that this is really going to come to the forefront even more as we move forward into a time when we are looking at doing away with all racial biases. And so, and that really does cut along a racial line a lot of times. Neighborhoods cut along a racial line a lot of times, and the health outcomes along those lines are remarkable. You're going to see a video in either next week or the week after that talks about zip codes and the difference in life expectancy one zip code to another can have just because of the neighborhoods. And so that's a very rich discussion and a very good talk that this doctor has for us. Okay, so that's really it. As far as the slide presentation, you have within Blackboard an assignment to complete if you did not make any face-to-face classes this week. And I should have probably reached out to you already and asked you to either do group 1 questions or group 2 questions. I usually assign group 2. They're a little bit more interesting. Group 1 talks about models a little bit, but they're good. In class, we just had tables discuss the different questions for maybe about 5 minutes, and then they reported out for a few minutes. So you didn't miss a lot with that particular discussion. I try to keep the rich discussions, I'm going to try to keep those to Zoom sessions so that you can participate in the breakout sessions. But complete that assignment. It's due by the end of the day on Sunday. And it shouldn't be more than a page or two. I'm not looking for a long paper. I'm just looking for some insightful answers to the questions that were provided. Okay, as always, reach out to me if you have any questions. If there's anything that's unclear or that you want to talk about more, reach out to me. We can have a Zoom session. We can talk on the phone. We can have an email exchange. I prefer the Zoom session. I like to see your face. I like to talk to you, but it's always open. My office hours, I did them this semester by appointment only, just because I'm not going to sit in a Zoom room for 8 hours. Since I can't be doing that in my office, I'm not going to sit in a Zoom room for 8 hours waiting for a student to plug in. So if you want to meet, just give me a call or text me or email. Okay? Have a good week, and I will see you next week. Bye.